Welcome back to the channel with me, your host, Dr. Debra Durst, and my co-host.
Hello, my name is Faraday Golembieski, and I am a board certified family nurse practitioner at RevitalyzeMD.
So first off, if you have not subscribed, please do so. It helps the channel. And today we want to do a great podcast and video on Peyronie's disease, but specifically on the treatment with vacuum erection devices. We have done videos on Peyronie's disease and videos on vacuum erection devices or penis pumps. Both have been very popular. And so I would look at those if you want further information. But today, specifically, Peyronie's, what it is and what a vacuum erection device is and how that might treat it. So what's Peyronie's disease?
So, it is the development of fibrous scar tissue within the penis, typically due from trauma.
Yes, trauma can be, again, something you don't even know you had, or it could be vigorous sex leading to trauma or otherwise, trauma in general. So that plaque is inflammation. So it is a collagen buildup that happens when you have some inflammation that starts. The collagen becomes aligned in an abnormal way, and that's just in the acute inflammatory phase. And then it forms a fibrous nodule sometimes or a growth. It gets bigger, and that is a more chronic phase, not the acute phase.
And that can progress to causing pain with erection or erectile dysfunction.
And I guess the most important thing is, again, curvature. We didn't like that scar, that fibrous, non-inflammatory scar that builds up causes curvature pain and pain with erections, and progressive over time with erectile dysfunction being the type of, being what our ultimate goal is for prevention. So you can use vacuum erection devices. The great thing about this is vacuum erection devices, or penis pumps for short, are great for so many things
And
related
easily
to that.
accessible.
Yes. And we have done a video. We've done a video actually on how to use it, on the one that we recommend and why I recommend it, and how to use it. So great video for that. But you can use it for so many things. There's lots of different forums with favorite pumps. So lots of information that you can get. But the nice thing about this for Peyronie's disease, it is one of the treatments that you can actually use in that acute phase. So if you just noticed a little bit of curvature, or you just had something happen from a trauma standpoint, you had pain and she came down on it the wrong way, reverse cowgirl being the most common position for that, then using a penis pump early on is one of the only interventions that is really recommended early on. From what we can find, obviously you can do acoustic shockwave, NPRP, anything that's non-surgical or not medical, but all the guidelines are for chronic phases. And
Absolutely. And they are listed on the Urological Association guidelines as an adjunct therapy, and there are studies to support it. So there is a 2016 study showing that even just 10 minutes twice a day over 6 months can reduce penile curvature by 10 to 20 degrees. That is a huge change, and something that you can purchase from us online through multiple sources, easily accessible, and do at home and have a positive benefit.
yeah, not only with this, but a positive benefit with lots of things. So we're talking about girth, potentially length. You can listen to
Improve
men
blood flow.
talking on blood flow, erection, quality, strength, firmness, and sensitivity. So lots of other things. And I'll probably repeat that with every study that we do. So not only does it have the result with this, but it has the result of all the other functional improvements.
So multi beneficial
Yes.
and multi purpose.
So 2012, they used it as a combination actually with one of the non FDA, or the FDA off label treatments with verapamil, which was an injected treatment. And again, we've never had patients that have had any injectable treatments whatsoever for Peyronie's when we see them, and we see patients with Peyronie's disease. So, but this was using vacuum erection device with an injectable, still off label from the FDA, with enhanced improvement. So that's good, but also a study from 2012 that showed vacuum erection device, or penis pump, in addition to traction therapy, which is PE,
Yeah.
penile traction. And basically it also showed enhanced improvements with the two together versus apart and just using one. So lots of forums for the PE or penile attraction on Reddit talking about what they do. But our standard treatment protocol is 10 minutes twice a day whenever we're doing regenerative treatments for the penis pumps. So that's based on these studies that we're seeing.
And
So,
we can add links to the studies in the show notes. It's always exciting to see studies on something that is a non-pharmaceutical because
yes.
it's hard to find good research when there isn't a bigger company making money off of it.
Yeah. Well, and so it's an effective treatment. It's safe. It doesn't have side effects. It's on a guideline that's 10 years old. So I guess that is like less important. But if guidelines are like strictly important to you, it's on a guideline just as a
Adjunct
yes,
therapy.
adjunct therapy. And but
So
if
that means
we
a therapy in addition to.
yes. So I just think if you think of medicine, 50% of what we learned in medical school was false by the time you got out and practiced. And it's about 10 years out before we actually make any changes based on studies. And so if you're looking to see improvement, prevention of treatment of something you're experiencing now and you're waiting for guidelines, and treatments to be approved, you're about 10 years out potentially. And this is a perfect example of a 2015 guideline with still emergent therapies that have not moved up into any, FDA approved or even off label use yet, just emerging therapies. So
But who
let's keep
knows?
that in
Maybe
mind.
we're approaching that 10-year mark. Maybe 2025 we'll get an update.
Correct. But we did do one update with women in the American Urologic Association, and
That's right.
nothing had changed in as of recently. So hopefully, I hope. But that is just a realistic fact. 50% of what we learn in med school is false by the time you get out and practice, and we're always behind in significantly in a time lapse by the time we study. And now I do think that there are some questionable sources of funding for studies. So, are we getting non biased studies? Because that should not be something that can happen when it comes to medical studies. So,
And medical guidelines. They should be
correct.
based on the facts.
Yes, absolutely. And no funding, and that is not the case with guidelines and organizations either in medicine. So, anyhow, let us know what you think. For sure, let us know if you've received any injectable treatments, if you've done anything outside of acoustic shockwave or PRP, so we can get feedback. But also, if you've done acoustic shockwave or P-shot or PRP,
Or used a vacuum erection device.
yeah, then let us know because we want to hear from you and your experience, and let us know if there's anything else that you want us to deep dive into regarding sexual wellness or wellness.